Hey, welcome back to Don't Spill the Milk with Cindy and Lynette. And for this episode, we're going to be talking about those first 48 to 72 hours of life. And we wanted to just share with you what you guys can expect. And so, Cindy, I know that you love talking about the golden hour. Can you tell us a little bit more about what that is?
I do love the golden hour. As a doula for 20 some years, I have seen a lot of parents experiencing that first hour or so after their baby is born. And I love observing and watching the interaction between the two of them. I think it's so cool when babies meet their parents and parents meet their babies and everybody starts communicating. And if you watch closely, you can really see. Typically speaking, where we live, babies are born and then placed straight up onto the birthing parent's tummy or chest. Oftentimes, the umbilical cord is left attached, and so the baby's getting lots of really oxygen-rich and iron-rich blood through that, and they are watching their parents and really quite fascinated. Usually within the first half hour or so, if babies are left skin to skin, tummy to tummy, with on their parents' tummy or chest, they will very often start licking and nuzzling, lick their hands, and then kind of make their way slowly over to one side or the other. And very often they'll just latch themselves right on. It's really cool, and it's a really important and neat way for babies to start unwinding from being bunched up in a little ball for the last few months. But they also, their microbiome is filled with all kinds of good bacteria off their birthing parent's skin, right? So it's really kind of in effect their first building up of immunity just from getting all that good bacteria inside their gut. And then, of
And
course,
speaking of that, speaking of that, that's the beauty of the golden hour for both vaginal and C-section.
Mm-hmm. Yeah. The cesarean-born babies don't have the benefit of getting that bacteria coming out, right? So yeah, they do get a lot of good bacteria off their birthing parents' skin that way. It's pretty cool. So if we were to just leave the baby there, they would just most of them would just kind of scoot their way over. It's really fascinating to watch. It can be a little excruciating to watch as a parent who just wants to get the baby on the breast and just feed the baby. But if you let them do it in their own time, they show you how smart and how clever and how well they can use those reflexes, right? All those reflexes that are so critically important with feeding.
And mom has instincts as well that you see that you can't teach it ahead of time. They react and make small movements themselves, reacting to their baby. That is really fascinating to watch as well. It's really intuition. Just they know how to move, and the baby then is able to latch on because mom is helping.
Exactly. Even the parents who don't think they have good parenting instincts, good parenting instincts, right? Yeah, you see it time and time again. What about when to feed the baby after the golden hour, Lynette? What do you recommend?
Well, I recommend that, you know what, anytime that baby wakes up, opens their eyes, starts to stir just a little bit, bring him to the breast, because we don't want to miss out on those tiny little cues that they're giving us, which can be very fleeting sometimes. We were talking about this before, and how, sometimes someone else might be holding the baby and the baby's showing these cues. And if we don't take baby right away and bring them to the breast, they might just go right back to sleep. And then we've missed that window.
Yeah. It's a bit of a coping mechanism, isn't it? If they open their eyes and it's not one of their parents, they often just slam those eyes shut and go to sleep because they're just not quite sure who that is. Yeah.
Yeah.
Yeah. Yeah.
So what about what about tummies? We talk about feeding these babies,
Mhm.
and like, how much should these babies eat?
Their tummies are tiny. They are way smaller than you would ever imagine they are. So in the first 24 hours, there may be 5 to 10 milliliters. And you don't really need to know that, do you? It's just a few drops. That's all they need that first 24 hour, each of those first 24-hour feedings.
Which is about as much as you get if you would hand express.
Absolutely. It's kind of cool how our bodies work, right? You make
Hmm.
exactly what your babies need.
Yeah.
So we are running out of time here. So we are going to focus in the next session on the following 24 hours. So the second 24-hour period. Catch us in the next one.
See ya.
Bye.